Hello everyone, welcome to Aanvii Hearing. Today, let us understand sudden sensory neural hearing loss. What are the various causes and diagnosis? Imagine waking up one morning and suddenly the world around you sounds muffled as if someone turned down the volume on life. For some individuals, this scenario is not a hypothetical one, but a reality they face. Sudden sensorineural hearing loss, also known as sudden deafness, is a medical emergency that can strike swiftly, leaving those affected anxious. In this podcast, we'll delve into SSHL, exploring its causes and how it is diagnosed. What is sudden sensory neural hearing loss? Sudden sensory neural hearing loss, often abbreviated as SSHL, is an alarming condition characterized by an unexplained and rapid loss of hearing, typically occurring in just 1 year. This abrupt hearing impairment can manifest suddenly in an instant or progressively over several days. It's crucial to emphasize that SSHL should be treated as a medical emergency. Delaying diagnosis and treatment may hinder the effectiveness of interventions. Diagnosing SSHL involves conducting a hearing test, specifically a pure tone audiometry. This test measures the degree of hearing loss in decibels across various frequencies. A significant indicator of SSHL is a hearing loss of at least 30 decibels in 3 different frequencies. To put this in perspective, a 30 decibel hearing loss might render conversational speech as barely audible, akin to a whisper. Individuals experiencing SSHL may have varied experiences. Some may wake up in the morning to discover their hearing loss, while others notice it when attempting to use the affected ear, such as during a phone call. There are instances where SSHL is accompanied by dizziness, ringing in the ears, also known as tinnitus, or both, often followed by an unsettling loud pop before hearing loss occurs. It's noteworthy that approximately half of SSHL cases will witness some degree of spontaneous recovery, usually within 1 to 2 weeks. Seeking treatment from a specialist in ear, nose, throat, and neck disorders significantly enhances the chances of hearing recovery. In fact, 85% of patients who receive prompt medical attention can expect some degree of improvement. Experts estimate that SSHL affects 1% per 5,000 every year, primarily striking adults in their 40s and 50s. However, the actual incidence of SSHL could be much higher due to frequent underdiagnosis. Many individuals experience a swift recovery and never seek medical assistance. Now, what causes sudden deafness? While SSHL remains mysterious in many cases, only 10 to 15% of those diagnosed have an identifiable cause. The most commonly recognized causes include infectious diseases. Certain infections can lead to SSHL, affecting the inner ear's delicate sensory cells. Trauma. Head injuries, particularly those involving the ear, can induce SSHL. Autoimmune diseases, conditions like Cogan's syndrome, where the body's immune system attacks its tissues, can lead to hearing loss. Ototoxic drugs. Some medications can harm the sensory cells in the inner ear, resulting in SSHL. Blood circulation problems. Poor blood circulation to the inner ear can compromise hearing function. Tumor growth. A tumor on the nerve connecting the ear to the brain can exert pressure, causing hearing loss. Neurological diseases. Conditions like multiple sclerosis may affect hearing. Inner ear disorders. Diseases like Meniere's disease can trigger SSHL. How is sudden deafness diagnosed? Diagnosing SSHL typically involves a series of tests conducted by an audiologist. The cornerstone of diagnosis is the pure tone audiometry, which assesses the extent of hearing loss and helps differentiate between conductive and sensory neural deficits. If SSHL is confirmed, Additional tests may be ordered to identify an underlying cause. These can encompass blood tests, MRIs, and balance assessments. Sudden sensorineural hearing loss is an unsettling condition that demands immediate medical attention. Its rapid onset and often unexplained nature underscore the importance of early diagnosis and treatment. While SSHL can spontaneously improve, seeking the expertise significantly enhances the chances of hearing restoration. If you or someone you know experiences SSHL, remember that prompt medical intervention is crucial. With advances in audiology, many individuals regain some or all of their lost hearing, restoring the symphony of life's sounds. To book an appointment for a free hearing test and trial, call us on 9658395839 or visit our website, which is www.aanvihearing.com.